Hey PK family, I am in Novovolynsk, which is in the Volyn Oblast. I am visiting Bodro Clinic. Rollers, you will remember Dr Serhiy, he was on with Rick and Sasha, Major Cool. And yeah, he was also on the shows quite a while ago. But he heard I was in Ukraine and invited me to come to the clinic to check things out. Hey guys, I have Dr. Serhiy here with me and gonna interview him now. Can you introduce yourself?
Yeah, my name is Serhiy Krzyżanowski. I'm head of clinic and owner of clinic Bodro Clinic in Ukraine. Before big war in Ukraine in 2022, we was one of the most innovative private clinic in west part of Ukraine. We work in 4 different roles: diagnostic, private polyclinic, operations, and rehabilitation. And one of our future potential things about what we think was medical tourism.
You showed me the clinic yesterday and I was amazed with, how much you do in-house.
Mm-hmm.
Can you tell me about, you said like the MRI experts, those you don't have in-house, they live elsewhere. Can you tell me a bit about that concept and how that works?
One of our trick of clinic and our heads and minds, this is our care of patients. Because we are not from big town, big city, and people who live around us must came 20-30 kilometers, and public transport is not so very good in our part of Ukraine. And when we think about what think patient, and patient think that when he come or she come to doctors and need to come one more time to take analysis or take MRI or take Röntgen, CT, he must come one more time, 2 times, 3 times, and we know how is uncomfortable for them. That's why we're thinking about care and about services. And in our mind, patient must take from his pain to reason and resolution of doctors one day. This is our goal. That's why we have all things what we can do in one day for patient to have a result of his pain. And after this, of course, doctor have fast resolutions, and patient have fast result.
Something that I find interesting is, your choice to start to start helping soldiers to rehabilitate.
Before big war, one of our very big and innovative work was rehabilitation. And before this, we work with 3 Olympic teams and do medical preparing them to Olympiad or in Japan. That's why we know exactly that in rehabilitation we are really very cool. And when war starts, we think that army hospitals will do all without us. But after a few months, we understand that it cannot be possible. We see how much soldiers come to us to take a help, and not just only help, but they want to find a reason what they can do with them's injury, because they have damage, trauma, other thing, ocular trauma, different type of injury. And we understand that this is our super potential for them, because our soldiers are not professional soldiers. This is civil people who want to fight with aggressor, with Russia. They never work like a professional soldiers. That's why they have a lot of trauma. This is why they have a lot of different type of medical problems.
I think it's a difficult thing to kind of navigate, to realize that, these aren't people who, planned their whole life to be a soldier. And then getting that injury and almost thinking, okay, cool, what do I do with my life now? And I think that search for meaning is something that's I think it can be very traumatic if you're not in like a place where you feel comfortable and get that safety and that support system. And I've met your staff. They are all super friendly. So I think that also really helps, them knowing, cool, there are these friendly people who care about them. We spoke earlier and you said that for the soldiers, you don't make food in-house, you give them like restaurant food. Can you explain a bit about your motivations behind that?
Before we starting to work with rehabilitation of soldiers, first of all, we think about process and about like big project of rehabilitation of soldiers, because it's really different from civil rehabilitation. And first of all, we think about what they feel when they have damage or they have any injury, and we understand process and what is traumatic in this process for them, and how and what we can do to change whole process for them, and how to be different from other public clinics what do bad rehabilitation, because we want to be the best and do the best. That's why we think that first of all we need to make a multidisciplinary rehabilitation, because when soldiers come to you, you never know what he have exactly, because when he have injured, this is one thing, but when he come and walk, army medicals are very fast, they cannot all see. And when he come to us, we do some checkup for them. A lot of doctors spoke. We do some meeting together about one soldier. We make a plan what to do, and we saw that first of all we need to have a guy who is motivated to make a rehabilitation. And we understand that motivation is in mind, in head. And it's not only in physical psychologist who can motivate. No, it's process motivation is motivation. Because good food, good sleep, good people, all things what see man or woman and think they want to care about me or no, they want to help me or no. These doctors really know what to do with me or don't know. And whole little bit things, including in process, is very, very important to have a motivation and to have a result.
Can you tell me a bit about your decision in like having the clinic here in Novovolynsk? Like, why not have a clinic, like, as you're planning to have Ukraine-based clinic, why not make it in a city like Kyiv or Lviv?
Very good question. Very good question. Maybe you know that in America, in not so big city town, Rochester, in Minnesota. They have best clinic in the world, Mayo Clinic. This clinic is have more than and stay there more than 100 years. And this is the best clinic in the world. In small town like Novovolynsk, I want to make Mayo Clinic in Novovolynsk. And nothing important that's not in Kiev or not in Lviv or Odessa. People and process make a best clinic. And motivation, working together and make good thing, make a best clinic in the world.
What has been like one connection or one soldier you've rehabilitated that really like stood out to you? Is there something that you were like, I don't know how I'm going to solve this, and then you found a fix, or are they all just like everyone's a new challenge, you just know, special connection with everyone?
We have a lot of soldiers where we don't know if it will be a good result or not. But we want to help. This is first goal. And our goal now is to make best results of regenerative medicine and regenerative of nerves and bones, because this is a very big problem, because a lot of soldiers have injury of nerves and bones. And now, thanks for Jana, we connecting with some professors from US, and we now connecting with one professor from Poland to make to use best technologies what we can find to have a good result of treating. And for this treating, first of all, we need to understand the problem of soldiers. And for this, it's really big quest sometimes, because we don't know. This is just only bone injury or nerve too. What we can do with infection, what we can do with moves in the leg and every time a lot of questions. Every time we need to connect together to spoke what to do, operation or not operation, physiotherapy or without physiotherapy, just only physiotherapist or physiotherapy like magnetotherapy or shockwave therapy or other thing. And thank for God, all we have, and we can use it. And of course, we scanning businesses near us, we're scanning good people in the whole world who can connect with us and can help us to make our work better. And I'm so happy that for this 2.5 year, we find and meet and spoke and work with a lot of very good people in whole world, in US, in South Africa, in Poland, in Slovakia, Germany, of course Ukraine. A lot of very nice people with whom we want to work. This is reason why we do it and do it together.
What are your next plans?
Next plans this year, we want to be concentrating in regenerative and regenerative of nerves. First of all, we have 3 partners. One very innovative laboratory, physiotherapy, and one professor from US with whom I hope so we will do a trio. And we want to use best technologies for regenerative and to work with from 3 to 20 patients with injury of nerves every month. And this is our plan and goal. And of course, for this, we need technology, we need money, because every patient must eat, must sleep, must have medicines and other things. That's why we trying to find partners and donators in whole world to help from 3 to 20 patients every month.
Is it difficult for you to kind of balance, because the clinic still runs as normal as well? It must have been quite a extra workload you and your staff took on to say you're still running like as normal, but you're also doing the rehabilitation of soldiers. How do you kind of prevent yourself from burning out, or are you just, motivated to go?
It's motivated us. It's really motivated us. Of course, when we have a good result, it's motivating for crying. It's right. It's like Olympic medal. It's really cool. That's every guy who had been in our clinic in rehabilitation, and when he came to army one more time and fight for our freedom, we are happy because it's our part too. And of course, we are not fighting. We're just making a good medicine. But this is our part in our country and in our free from enemy's world.
Yeah, I think that's good. Like, because people also ask me sometimes, like, do I get tired? And I'm like, obviously we get tired. And they ask, how do I stay motivated? And I just told them, it's a lot of work we put in, but even if it saves one life, it was worth it. So that's like so I completely understand where you're coming from when you're like, every guy who gets to return to where he wants to go, that's a victory and it makes everything worth it. So I completely understand where you're coming from with that.
And of course, when you make some good things together with good people, this is second motivation, because you see how many people are very clear and very nice, and I'm happy to find them, and I'm happy to work together.